Hi, I'm Dr. Kwame Williams and I'm a physician. I'm trained in podiatry medicine and surgery, but a large part of my practice deals with sports-related injuries. A lot of these things happen from a lack of stretching, improper support, or overuse. So these conditions and treatments will be discussed today. So we'll start by talking about soft tissue injuries or micro trauma overuse problems. These things happen when maybe you have an increase in activity, or you start an exercise or a training program without proper warm-up or stretching. A lot of times in the lower extremity, the most common places where these types of injuries occur are in the back of your body, of your lower leg, your calf, your Achilles tendon, and consequently your plantar fascia underneath your foot. Two things I stress to patients when trying to prevent microtrauma overuse injuries are, one, the warm-up period and your stretching part of your conditioning. The warm-up period is essential because it increases your heart rate and it gets your body ready for a workout. But just as important is the stretching part of any activity. If you stretch the back of your body, you elongate your calf muscle, your Achilles tendon, and you can kind of control or eliminate some of the soreness and injuries that can relate to the problems underneath your foot. So warming up and stretching your body is a big way to prevent the microtrauma overuse injuries. As we move on, a big part of sports medicine are bone injuries. You can get bone injuries from microtrauma or even macrotrauma as well. Microtrauma bone injuries result from a stress reaction, maybe even a stress fracture from a pathologic or unsupported part of your body. In this case, we're talking about your foot. Macro injuries can result from a sudden impact or a change in your body position as well while you're starting activity. Bone relates to the structure of your lower extremity. A lot of times there may be limb length discrepancies, pronation, supination, postural problems with your leg and foot. Those problems can create a condition where your foot is inherently unstable. When you have injury to your bone from an inherently unstable part of your body, the first stage is a stress reaction, where you may not have a physical sign of a fracture or a break, but you can see the reaction of that trauma occurring in the bone. If you progress and you don't stabilize that part of your body, that reaction can progress to a stress fracture, where you actually have a crack in the consistency of the bone. If you don't control that, it can move on to a more macro level injury for a true occult fracture. These things can happen from either overuse or from a major impact from an unsupported, unstabilized body. Problems are bone related or structural. They have to deal with instability. Particularly in a foot, there are 27 bones in a foot. The best foot has no motion. It's very structurally sound. The feet we treat are very unstable. They need structural support. Oftentimes we pair a bad foot with a custom orthotic to provide some of that inherent stability to an already injury-prone foot. We put this combination into a stable shoe, and it allows for a nice structural, stable, sound construct to move forward while you're trying to treat your sports-related injuries. If you have any questions with what we went over today, give one of our physicians a call at our 20 locations and we can go over these questions with you.